Hi and good day. Our group going to present about autoimmunity and autoimmune disease. First, what is autoimmunity? And what is autoimmune disease? So this part will be presented by our presenter, SOFIYYA. Next, what triggers autoimmunity and what are the causes of autoimmune disease? So this part will be shared by our presenter, Ling. Next, what are the common examples of autoimmune diseases and can it be healed? So SHAFIQAH will present for this part. And lastly, I will conclude for the whole video and share a bit of my own perspective.
Hello everyone, today we are going to dive into an important topic, which is autoimmunity and autoimmune diseases. So our immune system is like our defense mechanism that protecting us from the harmful invaders like bacteria and also viruses. And immunity itself is our body ability to recognize, defend against and destroy these harmful substances like bacteria, viruses and also other pathogens, which is ensuring protection from the diseases and also infections. But have you wondered what can be happen when our body defense is attack you instead of protecting you? So it is what we call autoimmunity. Autoimmunity is occur when our immune system is that's supposed to protect us is mistakenly target our own healthy cells, tissues and also organs. Instead of recognize these cells as a part of the body, they see them as the threats and losses attack that leading to the inflammation and also damage. This abnormal response does not only affect a small part of the body, it affects any part of the body, that from joint to skin and to the vital organ like heart, kidney and also nervous system. And in other words, it's like the autoimmunity is like a security guard that mistakenly the stop for the bleeding for intruders and trying to remove them. So this confusion is a root for a group of the disorder that known as the autoimmune diseases. But how can this can be happen? So let's explore the causes of the autoimmunity.
Autoimmunity can occur due to a combination of factors. Genetic predisposition plays a significant role because if someone has a family history of autoimmune disease, and they are more likely to develop it. For example, people with certain genes like HLA-DR1 are at the higher risk of developing rheumatoid arthritis. These genes can make the immune system more likely to malfunction and mistakenly attack the body own cells. Environmental triggers can also set off autoimmunity. This may include infections, exposure to toxins, certain medications, or even extreme stress. Infections like the Epstein-Barr virus have been linked to multiple sclerosis, where the immune system attacks the nervous system. Extreme stress as another example. Whether it's physical or emotional, it can weaken the immune regulation. Stress hormones can make the immune system overactive, increasing the risk of autoimmune disease like psoriasis. Sometimes the hormone changes can also increase the risk of developing autoimmune disease. Autoimmune diseases are more common in women, which may be linked to hormonal changes during pregnancy, menstruation, or menopause. For the example, at menopause, the sharp decline in estrogen can worsen autoimmune symptoms or even trigger new autoimmune diseases, such as Hashimoto's thyroiditis. Besides those factors and causes, poor diet, lack of physical activity, and negative lifestyles can also weaken the immune system and increasing the risk as well.
Rheumatoid arthritis causes the immune system to attack the lining of joints. This leads to inflammation, pain, and swelling. Over time, it can cause joint damage and loss of function. The symptoms are joint pain, stiffness in the morning, and fatigue. Next, lupus is a systemic autoimmune disease, meaning it can affect multiple organs such as the skin, kidneys, heart, and lungs. The immune system attacks the healthy tissue, causing inflammation and damage. The symptoms are joint pain, a butterfly-shaped rash on the face, and fever. And lastly, it also includes fatigue. And next is multiple sclerosis. It affects the nervous system. The immune system attacks the protective covering of the nerve fibers, causing disruption between the brain and the body. The symptoms are muscle weakness, numbness, difficulty walking, vision problems, and fatigue. Currently, there is no cure for most autoimmune diseases. However, the main goal of treatment is to control the symptoms, reduce inflammation, and prevent tissue damage to improve the quality of life. For treatments, medications play a key role. For instance, anti-inflammatory drugs will help reduce pain and swelling, while immunosuppressants will calm the overreactive immune system to prevent it from attacking healthy cells. Next, biologic therapies are more advanced treatments that target specific parts of the immune response. They provide precise relief for conditions such as rheumatoid arthritis and psoriasis. Next, physical therapy also plays an important role in managing autoimmune diseases such as rheumatoid arthritis and multiple sclerosis. Therapists have advised to teach gentle exercises that improve muscle strength, balance, and coordination, which protects them from further damage, improves their mobility and independence. Lifestyle changes are important too. Maintaining a healthy diet and regular exercise can reduce inflammation and boost overall well-being. Managing stress through techniques such as meditation or yoga can help prevent flare-ups triggered by emotional or physical stress.
So to wrap up, we have explored the world of autoimmunity. Starting with the questions, how our immune system, which meant to protect us, turns out confused and attack our own body. So we also discussed the causes of autoimmunity through genetic factors, environmental triggers, hormonal changes, and lifestyle habits. We also look at some common autoimmune diseases like rheumatoid arthritis, lupus, multiple sclerosis, along with the available treatments to manage them. Living with autoimmune diseases can be challenging, but it's important to remember that many people lead normal, active lives with the right care and management. So early diagnosis is the key. The sooner these diseases are identified, the better the chances of controlling symptoms, preventing serious complications. Second, by spreading awareness and understanding about autoimmunity and autoimmune diseases, we can reduce the stigma and help those affected get the help they need. With medical advances and healthy lifestyle choices, people with autoimmune diseases can still enjoy fulfilling, meaningful lives. So, never lose hope. Help is available and knowledge is the power. Thank you for watching our presentation. We hope you now have a clear understanding about autoimmunity and autoimmune diseases.